couple of minutes for questions.
Thank you so much. I learned a lot. Okay, so our questions. Let's start with, how would you reevaluate risk level at every visit? Won't that be too time-consuming?
Okay, good question. If you don't evaluate it, though, it may pose challenges for that session. Really what it is, and again, reevaluating risk level is, tell me how you're doing today. You know, and maybe what you can do is summarize. At your last session, you shared with me that you've been struggling with depression, that it's causing you difficulty with your eating, your sleeping. Tell me how that's going today. And again, that could actually be a nice segue into what the discussion is going to be for that time. If she is still at a very high risk level, you know, you may not be able to get the things that you wanted to be discussed, but again, if she is at a high risk level of depression, other risk factors like domestic violence, substance abuse, it does need to be addressed, because that's obviously going to be more critical than her blood sugar control that day.
Thank you. Can you give another example of how you would develop discrepancy?
Okay, so discrepancy again is heightening those differences between their behaviors and their goals. So sometimes when you have women coming in and you're just like, well, tell me, how are things going with your diabetes plan today? Fine. Okay, could you tell me more? It's great. Okay, how do you feel the meal plan's going? It's fine. Any questions or challenges? No, no questions, it's fine. Maybe what you can do then is get more specific and say, well, you know, let's take a look at your meal plan today. You wrote down these are some of the food choices you're making, and what do you know about eating this amount of carbohydrates at breakfast? Well, it raises blood sugars. Well, let's take a look at your blood sugar goals. Okay, they tend to be high when you eat this type of food. Yes. Well, what do you think could have caused it? And this is again putting it back on her. Developing discrepancy again is going to try to help her identify the behavior choices and how it affects her goals, as well as to engage her in more meaningful discussion. If she's giving you the fine, yes, everything's great, no problems, no questions, you're going to have you have somebody who's not engaged. She's not participating. So developing discrepancy can really help engage her, as well as to try to address some of those barriers.
Thank you. Hold on. Although it's a standard to screen for perinatal mood and anxiety disorders, I'm assuming at their clinic, it doesn't always happen. Do you have any suggestions for increasing our rates?
You know what I would say that everybody in your team needs to be educated on it. And you know, it was interesting, our nurse and clinic coordinator was the one who stressed it the most. This is something that you probably want to be discussing at your staff meetings, that this should be a standard of care. That if you have unaddressed depression and unaddressed anxiety, you're going to have patients who are going to be struggling with their diabetes plan and potentially get in a more crisis place. This is something that really should be discussed probably again at staff meetings by whoever is in charge of your program. That and what we've seen resistance in California is it really comes down to, if they are screened yes and it's high, do we have the options and treatment options for them? And this tends to be the biggest barrier. But really, this should be part of your forms. We have here something called Comprehensive Perinatal Service Program, where it is actually part of a checklist. Was it checked? Was it assessed? It is just as we are addressing behavior goals, blood sugars, depression is also addressed, domestic violence is also addressed. All those risk factors, it's just part of our forms.
Thank you. Next question. Do you have a resource website for where we can find the Edinburgh scale written in different languages?
You know, it's been a while, but you know, I'm happy to look this up. Cynthia, do we have this still on the CDAP website?
I don't believe it's on the CDAP website, but I will find the information and post the links with the rest of the resources for this session. So with the handouts and the rest of the stuff, I'll find a link and put it on there.
And if not, I have it in my office. I can always forward that to you.
Okay. Yeah, if you don't mind, it'll make life a little bit easier all the way around.
Okay.
Okay. What would you say when you are trying to roll with the resistance? How would you address it?
So roll with resistance. Let's pick an example. Let's talk about blood sugar checking. I forget. It sounds like it's really hard for you to remember to check your, well, tell me more about that, actually, I would say. I wouldn't make an assumption yet. Just tell me about, it doesn't look like you've been checking very often. Can you tell me about that? Yeah, it's just hard. I struggle with it. I forget. Okay, so it sounds like forgetting. Is there a lot going on? That must be difficult. So again, validating what her barriers are to not checking blood sugars. Tell me more about it. Okay, so it sounds like the blood sugar checking is a big part of it. When you're not checking, how are you feeling about your blood sugars? Well, I'm worried, I'm scared, I'm afraid to check because they're probably high, and I'm worried about my baby. So it sounds like it's something that's still very important to you. Well, what do you think would help you remember your blood sugars to check them? Well, I got a cell phone, and it's got a reminder feature on it. Okay, well, that sounds like a good idea. Would you think about setting that? Would that work for you? Well, maybe. So that's kind of a brief dialogue of getting blood sugar checking. Is doing a kind of a back and forth, validating, not avoiding judgment, avoiding giving her problem-solving solutions, and trying to get her to figure out what would help. Again, this might not be something that is completely fixed at that session. It might be something that you want to continue to revisit or may never be addressed completely, but it's something you want to continue to use that back and forth kind of banter with your client to make sure that it's, again, you're not problem solving, you're not fixing it, and you're not judging.
Thank you. Okay, I've got a couple that didn't make it onto the slide, so I'm just going to read these out. Can you provide your email for us to contact you with questions regarding centering diabetes?
Definitely. So, Cynthia, do you have it, or do you want me just to read it out?
Well, you can read it out, but I have it, so I can also post it on the website.
Okay, so it's M as in Mary, A-S as in Sam, U, L, L, J as in Jack or Jack-o'-lantern, at Sutter Health, SUTTERHEALTH.org.
Okay, thank you. Next question. Are your bipolar patients, et cetera, allowed to stay on their psych meds?
This is something that we do evaluate, and we do recommend they stay on their medication even during the first trimester. Some of our psychiatrists will recommend they go off it during first trimester and then resume a second trimester. But again, this really needs to be under the direction of a psychiatrist, especially what level of bipolar they have. If they have any psychotic tendencies with it, this is something that really needs to be managed by a psychiatrist. We have different and I'm sorry, this is a bit tangential, but we have some OBs who are resistant, and they would prefer them to be off it. But again, this is something you want to continue to discuss with the OB, what you're seeing.
Thank you. How can we reach out to our patients' partners who are not supporting diet plans, i.e. they're not agreeing with the diagnosis, the diet, or the treatment?
Again, I always invite them to come to these sessions. You know, it sounds like they may have some questions or challenges. Would you like them to come, or would it be okay if we talked on the phone? I would, you know, do I have your permission to talk about your diabetes plan with them? Because I would love to hear what their challenges or their frustrations or their worries about it. I'm sure your partner is supportive in having a healthy baby. Let's see if we can give them some more education to see if they can better support you.
Good, thank you. Where do you begin with a patient in the pre-contemplation or contemplation stage? How do you use motivational interviewing to engage and move forward with them?
Okay, so with pre-contemplation, I can definitely see a particular patient in mind where just hands are crossed, not looking, you know, maybe not even looking at me, looking down at the desk, very angry. It may not be a very long session. She might, you know, I might just definitely physical resistance. I don't want to be here, and really just acknowledging where she's at. You know, my name is Jacqueline, and just start off very slowly. Tell me about yourself. This is congratulations, first of all, on being pregnant. How are you feeling about the pregnancy? Maybe focusing on some things that are positive that she would like to talk about. You know, you came here today. What would you like to talk about today? You know, I have some things that I would love to talk about, but it doesn't sound like you want to talk about those things right now. You seem pretty angry about being here. Tell me, tell me what you would like to talk about. Well, nothing. I don't want to be here. I'm angry. I'm frustrated. Oh, so are there other things that you'd rather be doing? Yes, definitely. I could be doing da-da-da. Oh, tell me more about it. Again, just really trying to develop the communication with her, avoiding confrontation, forcing an agenda on her, and really trying to spend a lot of time in engagement, using expressing empathy, reflecting, listening. I would understand it would be hard to be here. I'm sure you are a very busy person and you have a lot of things going on in your life, and this is one of the last places you want to be. Yes, you're right. I don't have time for this. I don't think I even have diabetes. It's borderline. My blood sugars were really close. Okay, so you don't really think you have diabetes. Okay, well, certainly then, I wouldn't think that you'd want to be here. Well, what are your thoughts, though, about taking a meter home today and just doing a couple blood sugar checks and seeing what values you get? Maybe then we can talk about if you truly do. I mean, the diagnosis is this blood sugar, but let's take a look. You know, would you be interested in that? Again, I'm wanting to get her not to action mode, but to contemplation mode. I want to have a realistic plan that I'm not going to get this person into full maintenance level, but I just want to get her to consider it, to see some sense of value, and to come back.
That's wonderful. I love that script. Thank you. I think we do have one, maybe two more that I did get on here. Oh, okay. On the scaling questions, what is the next step after you get a 3 on your question? How do you address it and move it forward? I think it's similar to the pre-contemplation question.
Okay, so say for example we're asking, so on a scale from 0 to 10 to follow the meal plan, you put a 3. Okay, first of all, you're not at a 0. And that's good news. Tell me what puts you at a 3 today. Well, you know, I'm only doing it part of the time. Breakfast is easy for me to do, but I forget to bring my snacks during the day. And okay, so what would need to, so first of all, I see you making some changes. I see you're definitely doing something, and that's wonderful because this is a hard plan. What do you think would need to happen to get you from a 3 maybe to a 6? And in a 6, what is a 6 in your head? What does the 6 mean to you in regards to your meal plan? Well, maybe I'd be packing some snacks, or eating, you know, packing a lunch. Okay, so doing some planning, some meal planning, maybe. So you're talking that you can't just do this on the spot. You really need to take some time to plan these meals. Yeah. Okay. Yeah, that would probably make it to a 6. Okay. Well, what are your thoughts about trying that next time? And we can see how it goes. So that again, you're the 3. You know, any number that they're at, you can acknowledge the strength as well as address the barriers to what you know, because you want to get them at a higher number on the scale.
Thank you. I think the scripting is very helpful. Thank you so much. That was the last question. To our participants, please look at the last slide in your handout. There is a bibliography that Jacqueline put together for everybody back there.